Have you ever noticed how the little things, tiny, almost invisible things, can end up making the biggest difference? You know, like how a loose step can cause a dangerous fall. Or how skipping just one glass of water can leave you dizzy, tired, and foggy all day. Well, what if I told you that not cleaning just one small part of your body each day, just one, could silently lead to infections, serious discomfort, and even put you at risk for hospitalization? And here's the thing. It's not the spots you might be thinking about. I'm not talking about brushing your teeth or washing your hands. I'm talking about hidden areas, the ones we often overlook. The ones that don't get much attention, because, well, they don't seem like a big deal. Until they are. You might be thinking, I shower every day, so I'm good. But are you really cleaning the spots that matter most, especially after 60? Because as we age, our skin changes. Our immune system slows down. And simple hygiene habits that once seemed minor become absolutely vital. I've seen it happen more times than I can count. A loving spouse, a devoted son or daughter, or even an independent senior, doing their best, trying to stay clean and healthy, but missing just one small step each day. And then suddenly, painful rashes, strange smells, infections that won't go away, even hospital visits that could have been avoided. It's not your fault. No one teaches us this stuff. But once you know what to look out for, you can protect yourself or your loved one with just a few extra seconds a day. So in this video, we're going to walk through 5 specific body areas that doctors recommend seniors clean every single day. And by the end of it, you'll understand why these 5 spots are so important, and how missing even one can quietly chip away at your health and independence. And hey, before we dive in, do me a favor. Type "I'm here" in the comments if you're someone who wants to take better care of yourself, or someone you love, after 60. And if you're new to this community, welcome to Healthy Senior Advice. This is your space to learn, grow, and stay strong in your golden years. Make sure to subscribe so you never miss a tip that could change your life, or save it. Now, let's talk about the first spot most people forget to clean, but absolutely shouldn't. Behind the ears. Yep, that little space right behind your ear. Small, hidden, and usually forgotten. But it matters more than you think. Let me tell you a quick story. George was 72. A retired accountant, always well-dressed, hair neatly combed, even wore cologne every day. You could tell he took pride in his appearance. But one day, his daughter noticed a faint redness behind his right ear. Nothing serious at first, just a little irritation. He brushed it off, said it must be his glasses rubbing. A few days later, that small spot turned itchy, then raw, then painful. By the time he saw a doctor, the area was infected. Turns out, moisture and sweat had been building up there, day after day, without ever being cleaned properly. Now here's the thing. George showered every day. He washed his face. He brushed his teeth. But like so many of us, he skipped that tiny area behind the ears. And that's exactly why this happens. The skin behind your ears is soft, thin, and full of little folds. It's a spot where sweat, oils, and dead skin collect, especially if you wear glasses, hearing aids, or even a face mask. And as we get older, our skin doesn't recover like it used to. What might have been a minor irritation in your 30s can turn into an infection in your 70s. Now, here's where a lot of folks get it wrong. They assume a quick splash in the shower gets the job done. But the truth is, water alone isn't enough. And your regular face wash? It rarely reaches back there unless you're intentional. What should you do instead? It's simple. Each day, take a soft washcloth or cotton pad, add a small drop of mild, unscented soap, nothing too harsh, and gently wipe behind both ears. Make sure to dry the area well after, especially if you've been sweating, wearing glasses, or outside in warm weather. It only takes a few seconds, but the payoff? Fewer rashes, no lingering odors, and a much lower chance of skin infections. And that's a win at any age, especially in your golden years. But the ears aren't the only forgotten zone. There's another area that many seniors struggle with, especially women, but also men, and it's one of the most common places where infections like to hide. Let's move on to the second area. And this one is especially important for women, though men can struggle with it too. Under the breasts, and anywhere the skin folds. Now I want you to meet Mary, age 68. A sweet, cheerful woman who loved gardening and going to church on Sundays. She kept herself clean, wore fresh clothes daily, and took pride in looking put together. But one summer, she noticed something strange. There was a red, itchy patch under her left breast. She thought maybe her bra was rubbing the wrong way, or the fabric was too tight. So she changed bras. She used lotion. She even tried some talcum powder. But the redness didn't go away. In fact, it got worse, itchier, more inflamed, even started to peel. Eventually, Mary saw her doctor, and the verdict? A fungal infection, caused by trapped moisture, warmth, and friction in the fold under her breast. And here's what shocked her. She hadn't done anything wrong. She showered daily. But like many seniors, she hadn't been cleaning and drying that specific area properly. You see, under the breasts, inside belly folds, and even behind knees or in the groin area. These are places where skin rests against skin. And that means less airflow, more warmth, more sweat. Add in age-related changes, like thinner skin, slower healing, and more delicate tissue, and these areas become perfect breeding grounds for yeast, bacteria, and irritation. A lot of people think, well, I rinsed with water, so I'm good. But unfortunately, a quick rinse often doesn't reach deep enough into the folds, or clear out the oils, sweat, and dead skin cells that build up daily. So, what should you do? Start with a gentle wash using a soft cloth and mild soap. Avoid anything with heavy fragrance or harsh chemicals. Then, and this is crucial, pat the area completely dry. Don't rub, just gently press with a clean towel until no moisture remains. And here's a tip that many doctors recommend, especially during warmer months or for those prone to irritation. Use an antifungal powder or moisture-absorbing powder. It helps keep the area dry throughout the day, reducing the risk of skin breakdown or infection. Also, wear breathable clothing. Cotton bras or loose-fitting shirts can make a big difference in preventing sweat from getting trapped. It only takes an extra minute or two, but for someone over 60, that minute can be the difference between healthy skin and a painful, persistent infection. Now, you use your arms every day, right? Reaching, lifting, brushing your hair, eating meals. But there's one place connected to all of that, used constantly, and yet most people never clean it thoroughly. Now, let's talk about something we all rely on every single day. Your feet. And more specifically, the skin between your toes. It might not sound like a big deal at first, but I want you to hear this story. Tom was 75. A proud grandfather of 5. He loved working in his garden and taking walks with his dog every morning. But Tom also had diabetes, and like many seniors, he didn't have full feeling in his feet anymore. It's called peripheral neuropathy, and it's incredibly common in older adults. Tom showered regularly. He thought he was doing just fine with hygiene. But one day, he noticed his toe looked different. A little red. Slightly swollen. Still, it didn't hurt, so he brushed it off. But over the next week, that redness spread. The skin cracked. Then came the smell. By the time he saw his doctor, the infection had gotten into the tissue. Tom needed minor surgery to remove the infected part of his toe. All from neglecting one tiny area, the space between his toes. Now here's why this happens. Our feet work hard. They carry the full weight of our bodies every single day. But as we age, two major changes happen. First, circulation slows down, especially in the lower legs and feet. That means it's harder for the body to heal from small cuts or irritation. Second, nerve endings lose sensitivity. So you might have a blister or skin breakdown, and not even feel it. Add to that the moist, warm environment between the toes. And suddenly, it's the perfect spot for fungus, bacteria, and painful infections to grow. And here's what most people get wrong. Standing in the shower isn't enough. Water runs over your feet, sure, but that doesn't remove trapped dead skin, sweat, or moisture hiding in those tiny crevices between your toes. So, what can you do? Make foot care part of your daily routine, especially if you have diabetes or circulation issues. Every day, gently wash your feet with warm water and mild soap. Then, this is important. Dry them completely. Not just the tops and bottoms, but in between every toe. You can use a clean towel, or even a soft tissue to reach those narrow spaces. After that, apply a non-scented moisturizer to the heels and soles, not between the toes, though. That area should stay dry to prevent fungal growth. And check your feet daily. Look for cracks, redness, swelling, or any changes. Use a mirror if you need to, or ask a loved one to help. Tom learned the hard way. But you don't have to. Just a few minutes of care a day can protect your feet, your mobility, and your overall independence. And now, let's move to another area that almost nobody talks about. Yet it's one of the most common sources of irritation, odor, and long-term skin damage in older adults. Now, this next one might surprise you. The belly button. Yep. That little spot in the center of your abdomen that we often forget is even there. Let me tell you about Sally, a 74-year-old grandmother who adored baking cookies with her grandkids. One day, her granddaughter gave her a hug and wrinkled her nose. "Grandma, what's that smell?" she asked innocently. Sally was embarrassed. She hadn't noticed anything unusual. She bathed regularly, wore clean clothes, and always looked presentable. But the odor persisted. After a closer look, and eventually a visit to her doctor, they found the source. An infected belly button. Now, I know what you might be thinking. The belly button? Really? But yes, it happens more often than you'd expect. You see, the navel is a small, enclosed space, especially if it's an innie. That makes it a prime spot for sweat, dead skin cells, lint, and even bacteria to accumulate. And because it's tucked away, many people, especially seniors, don't clean it regularly. Here's what's happening inside. The belly button doesn't get much airflow, and it doesn't rinse clean easily just from a quick shower. Over time, it becomes a warm, dark, moist cavity, the perfect breeding ground for unwanted bacteria or even yeast. And once that bacteria starts to multiply, it can cause itching, redness, a sour odor, and in some cases, minor infections or even discharge. The truth is, many seniors assume this small area doesn't need much attention, or feel uncomfortable cleaning it. But leaving it alone can actually lead to discomfort, infection, or embarrassment. So how can you take care of it? It's simple, and takes less than a minute. Once a day, during your hygiene routine, use a clean cotton swab or soft cloth with warm water or a bit of mild soap. Gently clean inside the navel. Don't dig or scrub hard, just a soft, circular motion will do. Then, just like with the skin folds we talked about earlier, make sure it's completely dry. You can use a clean corner of your towel, or even a dry cotton swab to absorb any remaining moisture. If you notice redness, swelling, pain, or an unusual smell, don't wait. Talk to a healthcare provider. These are small signs that the body is telling you it needs a little extra care. And just think, something as tiny as your belly button can make a big difference in how clean and confident you feel. Now, we've covered 4 important spots so far. But this last one? It's deeply personal. It's sensitive. And it's often overlooked, not just physically, but emotionally too. Because it's about more than hygiene. It's about dignity, comfort, and self-respect. Let's talk about the final area on our list. One that's often the hardest to bring up, but one of the most important for your health, comfort, and dignity. Your private areas. I know, it's not easy to talk about. For many seniors, even the thought of it feels uncomfortable, even a little embarrassing. But let me tell you something right now. There is nothing embarrassing about caring for your body. Let me share Margaret's story. She was 76. Independent. Strong-willed. A retired nurse, believe it or not. But when she started to feel a bit of discomfort down there, she ignored it. She told herself it was just part of getting older. She didn't want to bother her doctor. And she certainly didn't want to talk about it with her daughter. A few weeks passed, and that discomfort became a burning sensation. Then came the urgency. And eventually, Margaret ended up in urgent care with a urinary tract infection. Painful, exhausting, and completely preventable. Here's what's happening in the body. As we age, our skin becomes thinner and more fragile, especially in the genital area. For women, hormonal changes can also lead to dryness and increased sensitivity. For men, hygiene issues can contribute to infections or even prostate irritation. And yet, this area is often neglected or treated improperly. Here's a common mistake people make. They use strong soaps or scented products, thinking it's more hygienic. Or they scrub too hard, trying to get extra clean. But this can actually do more harm than good. It strips away natural protective oils, disrupts the delicate pH balance, and opens the door for irritation, rashes, and yes, even infections. So what should you do instead? Keep it simple. Use warm water and, if needed, a mild, fragrance-free soap, something gentle, made for sensitive skin. Avoid harsh scrubbing. Instead, wash gently, pat dry with a soft towel, and make sure the area is completely dry before dressing. And this next part is just as important. Wear breathable, loose-fitting underwear, preferably made of cotton. Tight, synthetic fabrics trap moisture and heat, which is exactly what you don't want. If you or your loved one wears incontinence pads or adult briefs, make sure to change them frequently and clean the area after each use. And always be on the lookout for redness, itching, or any signs of infection. Because the sooner you catch it, the easier it is to treat and prevent from returning. Now, I know this isn't the most comfortable topic, but these conversations, these truths, are acts of love. Taking care of this part of your body isn't just about cleanliness. It's about dignity. It's about being able to move through the day without irritation, discomfort, or shame. And it's about protecting your health, quietly, gently, but powerfully. These 5 areas we've talked about today might seem small. Behind the ears, under the skin folds, the feet, the belly button, and yes, your most private areas. But ignoring them? The consequences can be life-changing. Now, let's take everything we've learned and bring it together. Because what comes next is just as important as the knowledge you've gained. So, let's quickly recap what we've covered today. 5 body areas that seniors must clean every single day for better health, comfort, and longer life. Number 1. Behind the ears, a hidden spot where sweat and bacteria love to hide. Number 2. Under the breasts or inside skin folds, warm areas that need attention to prevent rashes and infections. Number 3. Feet and between the toes, where poor circulation and moisture can lead to serious problems. Number 4. The belly button, a tiny place that can collect dirt and bacteria if overlooked. And finally, number 5. Private areas, where gentle care protects dignity and helps prevent infections that are far more common than most people realize. Each one may seem small. Each one may be easy to forget. But caring for these 5 areas can make the difference between living in quiet comfort and dealing with preventable pain, infections, or hospital visits. Now I'd love to hear from you. Which of these areas surprised you the most? Maybe there's one you hadn't really thought about before. Or maybe you, or someone you care for, has had a close call because one of these spots got overlooked. Share your thoughts in the comments. Your story might just help someone else feel seen, understood, or inspired to take better care of themselves. And if this video gave you something to think about, if it brought you value, or helped you understand your body, or a loved one's, a little better, then please, give it a like so more people can find this important information. And don't forget to subscribe to Healthy Senior Advice. This is more than just a channel. It's a community. A place where we talk openly, without judgment, about the real challenges of aging, and how to face them with wisdom, care, and courage. Every week, we share gentle guidance, doctor-backed advice, and heartfelt stories for seniors and caregivers who want the very best for their golden years. Thank you, truly, for spending this time with me today. I hope you walk away feeling empowered, not overwhelmed. Because your health is worth protecting. Your comfort is worth preserving. And your dignity, always, deserves to come first. Until next time, stay healthy. Stay kind to yourself. And from all of us here at Healthy Senior Advice, take care. We'll see you in the next video.